What's up, everybody? Welcome back. I'm going to talk a little bit today on rehab exercises. I'm going to give it a minute, again, as I usually do before anybody hops on. As always, if you have any questions about anything we ever talk about in this group, feel free to message me to let me know and to tag me in any posts, and we'll go from there. But big thing today, we'll talk about rehab exercises to correct lower back pain. Specifically, we are going to be talking about what I call phase 2. Hello, welcome. And we're going to talk about phase 2. So phase 2 is pretty much, there's 3 phases, right? We talked about this in the past. We're going to continue on this little theme for a little bit. So we have the relief phase, we have the corrective phase, and then we have the training phase. I also like to include a block 4 or a phase 4, which is pretty much returning to play, meaning returning to whatever you love to do, essentially as if the injury was never there. But today we're going to talk about corrective care, and the whole goal of corrective care or correction is to correct the problem, right? It's to allow you to have support and to start adding support to your own thing. So let's think about it like this, right? If you are somebody out there are familiar with any construction, hey Katie, so if you're familiar with construction, a lot of times they build a foundation, and this is where a lot of people spend most of their time. They spend a lot of their time in corrective care because they're building that foundation. So if you are familiar, like I said, with construction, you'll notice that when they dig a foundation, it takes quite a while for them to dig it out, to solidify it, to add the rebar and all that other stuff. And then you go back about a month later and they're still doing the same thing. And then you go back about maybe a couple months after that, and then you notice that there's like 4 floors, and it's really easy to get to the next level. The way it's really easy to get to the next level is to have a very strong foundation. So it's really worth your time and energy putting the effort into your foundation of your exercises, and corrective care does just that. So let's also talk about kind of another little example I like to say is, when somebody's building something, it may just be for a little bit of duration. It's supposed to get you some strength, but it's also designed to really help you support that area. So corrective care or corrective exercises, that we call it corrective exercises, are the minimum amount of exercises you need to, hey Hojang, so that you need the minimum amount of exercise you absolutely need to get the maximum amount of result. Everybody's different. I know I'm going to say that. You're going to hear that for the rest of your life, but that's totally true. But there are a whole host of things that actually do help. And when people talk about corrective care and they like YouTube things and check things on Facebook and Instagram and all these cool things, it tends to be those exercises that are on the floor. They're usually involving bands. They're usually involving crawling or being ground-based. And there is a real strong reason for that, is because you're slowly trying to add resistance to help build the exercise, to help solidify that foundation so that you don't keep injuring it. If you don't build that strong foundation, that is where you are going to fail. And all too often, many people will go into pain, they'll start getting better, and they'll fall after a few weeks. And the reason they fall after a few weeks is because they don't spend enough time in that foundation. I would honestly say that most people should spend about 60 to 70% of their time, probably more like 75%, 75% in that foundation, as opposed to pain or performance. Because once you're in pain or performance, you're doing all the things that you pretty much love to do. Maybe a slight limitation, maybe you're not going as heavy, but the foundation is what gets you there. And these are movements that I'm going to talk about today. So let's talk about these movements, right? I have them listed out right here. So the first thing we're going to talk about is a hip hinge, right? I talk about this all the time. I talk about bending from the spine, how the spine can get injured when we bend. And when we start to round our spine like this, we add much pressure. So what we're going to do is we're going to learn how to hip hinge properly over and over again. This could be standing. This could be seated. Most of the time it's standing, because a hip hinge helps you get into a squat. It helps you get into deadlifts. It helps you lift groceries off the floor. And it's exactly what you think it may sound like. It's hinging from the hip, not from the spine. It's not called a spinal hinge. It's called a hip hinge. A spinal hinge would be this. You're rounding thing. A hip hinge is staying up and down. Okay, it's really hard to show you in this setting, but go ahead. I definitely post some videos on these on the Facebook group. So hip hinging and all that other stuff should be available. If it's not, check out my YouTube. If it's still not available, I will eventually get to that. There's definitely videos that I post. I do a live every week, and to answer your questions about this stuff, and I also post at least one video per week to help you guys get some exercises and mobility in. So a hip hinging is absolutely critical. Also, I do like to start incorporating a little bit more resistance training when it comes to glute strengthening. The glutes are super important, guys. A lot of people just say it to say it. They are. They are what is going to control, or they are what's going to control your stability of your hips and your pelvis. The hips are the engine of human movement. And if you don't keep moving, if you don't keep engaging those butt muscles, you're not going to help stabilize your spine, because you're not stabilizing the pelvis either. So the glutes can really include the glute max as well as the glute medius, even part of the piriformis. You can use as part of the glute encompassing term. But a lot of people don't strengthen the glutes strong enough, and then again, they don't advance to more challenging exercises. So corrective exercises are really interesting because you can make them extraordinarily hard, and you can make them extraordinarily easy. But once you have gone from this progression to this, it should start to look like training. Like, it should start to look like your rehab program towards the end of corrective care and into training should really start to look like you're actually in the gym and training. It shouldn't look like, okay, we're just going to do this little band here and just go back and forth. It should really look like very tough corrective exercise. And I think a lot of physical therapists, chiropractors, physios, people in movement, they don't challenge you hard enough. You need to work hard enough that you will get the stimuli without working too hard, without injuring yourself. That is key, guys, and that really takes a little bit of a skill and fine combing. It really takes evaluation, unfortunately, sometimes, and it really takes somebody watching over your movements potentially for you to make that change. But hip hinging, glute strengthening, and I have things like crawling. So crawling, cross crawl movements, bird dog, those are a good extension and flexion based exercise. Those are very important to actually crawl on the ground and engage your hips, your arms, your core all together, but without as much vertical force going up and down. So these are corrective care exercises. These are very, very, very important. And I would say that most of the patients that I see, most of the people I coach with, most of the people I deal with, we get them out of pain, we help correct the exercises, and most of the time people drop off right after that because they feel like they can do it themselves at that point in time. But if you've done relief phase, you've done corrective phase care, and your rehab properly, and to a point where you've advanced it, it should look like you're training. From there, it's just about fine-tuning it, and it's about fine-combing exactly your condition and your issues, because at that point in time, you're pretty much over the hump and you're ready to go. But you should spend most of your time between the relief phase and the corrective phase. And if you guys don't know what I'm talking about, there's a resource that I created in a PDF. It's called Phases of Care. Go click on that, go download that, hang that up on your bulletin board. I highly recommend doing that because it's going to be really important for you. But again, guys, corrective care is giving the minimum amount of exercises necessary to get the maximum amount of results while you still can train and not injure yourself and get to the next level as well. So your time in corrective care can take about 75%. So definitely would recommend you guys doing that. The rest, once you're out of pain, it should be close to training. You should be good to go. And then that should be it. So if you guys have questions on this video about hip hinging, glute strengthening, abdominal exercises or something like that, and crawling and stuff like that, these are some great exercises that we talk about with regard to the corrective care. So if you have questions, guys, like always, definitely check it out. If you want to review any of these videos or any of this information, this video is saved not only on my YouTube, but in this group alone. So thanks, guys. Have a good day. Have a good weekend. And I appreciate all of you. And if you have any questions, like I said, I'm always here. I'm always here to help. And that's what this group is here to do, is to help you guys with your back pain and really make a difference out there, because back pain is rampant. If you know anybody suffering from back pain, ask them to join this group, invite them. There is no constraints. They just have to enter their information to come into the closed group. It's really simple, but that's it, guys. So have a good day. Have a good weekend. I'll see you guys next time.